Okay, we're ready to go. Elizabeth.
Great, thank you, Casey. Good morning, everyone. It's great to see so many of you returning once again for one of our Wednesday 10 a.m. COVID-19 briefings. My name is Elizabeth Murphy. I'm the Director of Creative New Jersey. On behalf of my colleagues, Casey O'Brien, Annette Mitchell, Alyssa Calderon, we welcome all of you to today's briefing. As Casey had mentioned before, this is the 8th briefing that we've done in a series that we started on Wednesday, April 1st. So each week we've picked a different topic around, big important issues that New Jerseyans are, dealing with in response to COVID-19. So I'm sorry if my video just went out a little bit. Sometimes my connection is unstable and I got a message across my screen that said the connection's unstable, so bear with me. We've been fortunate to hear from all different folks around the state on some of these big issues, right? We've heard from our friends at the Center for Nonprofits who gave us an overview of the CARES Act. We had a briefing on media and what local journalists are doing. We had a briefing on the state of education, K through 12, and then higher ed. We had a call on the philanthropic response around COVID-19. We talked about mental health a couple of weeks ago and how folks are, dealing with the extreme pressure that, many of us are feeling in response to what's going on. We've talked about how people with disabilities are managing the COVID-19 pandemic. Last week, we learned more about the challenges that seniors are experiencing. And today we're talking about food security and food access. So all of this information, there's summary reports on all of those calls are available on our website at creativenj.org. And we hope that you find them useful, and we hope that you share them with your networks. One of the things that we say every week together is that, all of you, we're all connected together to all of you, but you're all connected to other people in your communities and your cities and your communities and statewide. So we hope that together we are helping to push out all of this really important information that we hope help people to better respond to the crisis. So next week, we're not going to have a call, right? Just so everybody knows, we're going to take a breath. And it's Memorial Day, so we're just going to take a quick pause, but we're going to return again for 2 more calls on Wednesday, June 3rd, Wednesday, June 10th. So you can stay tuned for information on those calls. Today, we're really grateful to welcome our friends and colleagues from Robert Wood Johnson Foundation, from Passaic County Food Policy Council at the United Way of Passaic County, and from Cathedral Kitchen in the city.
Oh, so we may have just lost Elizabeth because of her connection, but from here, it'll usually take a moment and then she'll be back on. And I think there she is.
Okay, Elizabeth, are you good? Sorry. Yes, I'm good. Thank you, Casey. So I've asked all of us, can we just take a deep breath just before we start? Let's take a deep breath in. Right, we'll just bring our attention into the center of our Zoom room, right? I know everybody has some Zoom fatigue, but we'll just try to really be present for the call today. We're so grateful to everybody who's also able to launch your video because it allows us to connect with each other, right? It allows us to actually talk to each other and keep our network strong. We want to continue to support each other throughout this time. So today, as we mentioned, we're talking about food security and food access, an extremely important issue and challenge for lots of New Jerseyans right now. And our speakers, they're going to talk for a few minutes. They'll talk for 5 or 7 minutes. We'll do a Q&A after each one, as most of you know. And then at the end of the call, around 10 to 11 or thereabouts, we'll open it up for more questions and discussion. We'll stop our recording at 11 o'clock, but as you know, we stay on for another 15, 20 minutes, sometimes even a half an hour, so folks continue to connect further. Well, we'll have that opportunity to do so at the end of the call. So now it's my great pleasure to introduce our first speaker. Dwayne Currie is the program officer at the Robert Wood Johnson Foundation. And Dwayne's going to share with us this morning some information on a national and statewide perspective around food security and food access. So Dwayne, I think you're unmuted. Thanks so much for being with us today. And I'll turn it over to you.
Of course. Thank you so much. I'm really glad to have this opportunity to speak with you all about this today. At the foundation, I work in a unit that focuses specifically on the health of children and families throughout the country. And our goal is to ensure that all families, no matter their backgrounds, no matter how much money they make, have the opportunities that they need to thrive. And in order to do that, they have to be able to foster a healthy environment, beginning at a child's earliest age. And within our two strategies, focusing on shifting mindsets so that children are seen as deserving and also advancing policy, food security is something that is also very critical to that. According to the USDA report in 2019, there are over 37 million Americans that struggle with hunger, and 11 million of them are children. In New Jersey, it's about 865,000 adults, which is about 1 out of 10 adults. And for children, it's about 1 out of every 8. It's a little bit over 260,000. So food insecurity and access is impacting everyone throughout the country. And one thing I would like to offer just very briefly to add additional context to our conversation is to speak a little bit pre-COVID about how this has been a huge impact. One thing I want to speak of specifically is about income inequality. Specifically, New Jersey is ranked in the top 10 for the most unequal states regarding income inequality. It's ranked number 9. It's trending in the opposite direction of what's 12 a few years back. And the only states that are above it are, in order, it's New York, Louisiana, Connecticut, being the top 3, Florida and California, and there are a few other states as well. And what you see is, the reason I want to add this is because in New Jersey, it's this narrative of 2 states in one, where you have the rich versus the poor, those who have access, those who don't, and often it sits right in our backyards. One example that I give before I dive deeper into food security is you take the 3 highest counties that have these inequalities, which are Essex, Hudson, and Mercer County, Essex being the top. And you have a city such as Milburn, where the average household income is about $214,000. Just not even 10 to 11 miles across the way, when you go to Newark, that drops to about $37,000. So again, this is the same county and a wide range of inequality just within this county. And this is a narrative that happens throughout the state and also throughout the country. One of the things that's important to think about is, in that context, then COVID-19 hit and really elevated a number of issues that, in addition to this, that was often below the surface. And in response to that, the federal government provided billions of dollars in funding to really prevent hunger. And part of that funding went to programs such as SNAP and WIC and school food programs. I'll hone in on SNAP just a little bit to provide additional context of how it's been responding during this time. So SNAP is the largest nutrition assistance program in the country. It served in 2019 over 36 million families. Of those families, 36 million people, sorry. Of that, there were about 10% that were families that 13 of elderly families. 10% of those families were families with disabilities, and the rest were others under the age of 50 that didn't have children. Specifically in New Jersey, it was about 680,000 people that SNAP served. About half of those, about 46%, were children. About 18% were elderly population, and surprisingly, about 30% served people with disabilities, which is 3 times the amount on a national level. During this time, SNAP has shown to really assist in a number of ways. One is SNAP has really proven to lift people out of poverty. Just last year, it was about 3.1 million people that were lifted out of poverty throughout the country by participating in SNAP. SNAP also has proven to boost the economy. Economists estimate that about for every one SNAP dollar that is utilized, generates about $1.70 in economic activity. In New Jersey, you'll see not that long ago that just over $1 billion was generated through SNAP, and that generated about $1.7 billion in economic activity. During this time, there's been a lot of flexibilities within SNAP and other programs, and I believe a resource was just shared that covers some of those flexibilities. One thing I'll say about New Jersey is New Jersey has been moving forward with a lot of these flexibilities and waivers. Some of the most important that I do want to highlight is one is pandemic EBT. And what that does is that it allows for children that would receive free and reduced lunch at school to be able to access those meals. And what happens is if people are already enrolled in SNAP, that additional funding, which averages about $110, $114 per child, is automatically added to their SNAP EBT, to their EBT card. And for those who aren't registered in SNAP, a card is sent to their house. This is really important, especially for populations that may not have received support during this pandemic, especially immigrant and mixed status populations who, due to public charge, have avoided participating in programs such as SNAP. So many cities as an opportunity to provide support and assistance to many people who wouldn't otherwise have had it. The other flexibilities that I won't go into for the sake of time, but there are waivers, there are flexibility with interview processes that have been extremely helpful during this time to make sure that more people are able to participate in SNAP. One thing I'll give a little bit of input on before I open up for questions. The foundation on a national level and also within the state we provided a $50 humanitarian relief specifically as a response to what's going on. And some of that relief went to organizations such as Feeding America, who provide support to over 200 food banks in the country and over 600 food pantries. The Community Food Bank of New Jersey being one of them, who's been doing a tremendous job supporting people throughout the state. They're packing about 2,000 boxes of food a day, which provides meals to about 80,000 meals a day. And thank you, Casey. You're really on it with sending these links. So that's a link right there that actually allows you to search by zip code and allow you to see what food banks are open and providing services in the area. Other support has gone to organizations such as Meals on Wheels, who provide food to about 2.2 million seniors and also people with disabilities. There's been an ongoing effort throughout the state to really band together during this time in support of one of our partners, New Jersey Health Initiative, which is a statewide grant making program for RWJF. They've been really serving a key need to reach some of the smaller communities that may not have access to charitable funding. And with some of their partners, some of their grantees, they've noticed that they've been shifting their projects to really focus heavily on food. For example, in Per Fanboy in Somerset County. And some of the things that they've been seeing is they've been seeing some of their partners have been providing additional food for community members, or being able to pay volunteers who may have been suffering from either a loss of job or unexpected hardship. Also, in closing, because I want to make sure we have enough time, other groups in partnership, the New Jersey Partnership for Healthy Kids, partnership with the Y Alliance, they've been doing an excellent job at really being able to provide support for the houseless children population. So ensuring that they have the meals that they're able to get that they may have been missing. And they've been specifically focusing in Bergen and increasing efforts in Passaic County, along with delivering hot and cold meals to hygiene products to the Trenton district. So there's a number of different efforts that are going on throughout the state. School districts banding together to be able to provide food for children. There's been flexibility with SNAP educators now being able to assist in the SNAP benefit application and processing efforts, which is very new. So basically in closing, during this difficult time, it really takes a joint effort from a number of people in order to counteract what's going on. So I'll shift it back to Elizabeth for any additional questions before we go.
Thanks, Dwayne. Thanks so very much for sharing all that information with us. And as Dwayne mentioned, Casey's been dropping a lot of links into the chat function, which, all of that information that's in the chat function will also be included in the summary report that we send out later this week. So if folks aren't grabbing it from the chat now, you'll have another opportunity to access the information in the summary report. So I'll turn it over to Casey, who's going to moderate a Q&A now with Dwayne. Thanks, Casey.
Great. Thanks, Elizabeth. So just a reminder for folks as to how this will work. If you are on video with us, if you want to raise your hand by clicking the little blue hand icon in your participants section, you can do that. You can drop a question into the chat box. If you're on the phones with us only, you can *6 to unmute yourself and then ask your question there. So if anybody's got a question, go ahead and raise your hand or drop it into the chat. And we'll just give it a minute or two there for folks to formulate their thoughts and drop that in. And while that's happening, there are a lot of links that we just dropped into the chat, so there's plenty to look through after the fact. I'm just quickly looking through the chat here. Elizabeth, I don't know if you have a question in the interim. Oh, sorry, we've got one.
Great.
So Sergeant Stewart, if you want to go ahead and unmute yourself and ask your question.
How are you? Thanks for having me on the call. One issue we've been having is our undocumented community members providing them and their families the services that they need. We all know that they don't qualify for SNAP. We've been relying heavily on local food pantries, such as Center for Food Action, such as the Community Food Bank. They've been amazing to us. Has there been any other options for undocumented families that you could refer or put into the chat?
In New Jersey, not yet. But there are some upcoming efforts that I believe that may happen. There have been other efforts in other states, such as California, where the governor is working towards providing direct cash assistance to immigrant populations and mixed status families. So there are other models throughout the country that I'm sure states are starting to follow in suit. There are other organizations that have been really helpful and tracking this and providing the proper education and information to groups that are interested about this. A few that I add is CLASP, C-L-A-S-P, is a great organization that's been focused on this, and also the National Immigration Law Center are two organizations that have been really tracking and trying to provide information about this. Also, one more is Unidos, US. Which works directly with Latino and immigrant and mixed status families as well.
Thank you. Thank you.
Great.
Hi, Casey.
Thank you. Thank you, Jeff. Oh, yep, go ahead.
Hi, sorry, I'm on the phone, so not able to raise my hand. This is Margaret from the Dodge Foundation. I want to just alert all the listeners to an organization called City Green out of Clifton, New Jersey, and they run a really great program called Garden State Food Network. And what this does is they provide funding and technical assistance support to farmers markets throughout the state to double the SNAP benefits for purchases at farmers markets. So if that's a link that you could provide folks, that would be great. One of the things that we're seeing in the food systems world is that there is a growing recognition and appreciation for the direct consumer to farmer connection. And farmers markets are really serving a really important role right now in providing an additional opportunity for consumers to purchase directly from farmers. And so this Double Up program is really essential right now to providing SNAP beneficiaries access to farmers markets and doubling those benefits at those markets. So that's a great resource for folks.
Definitely.
Great, thanks, Margaret. I do have another question here in the chat. One of our participants says, I'm a teacher. My students have participated in a food drive. I'm not sure if that is the best way to support food insecurity. A recent call with Ronald McDonald House, I was told that making financial donations is the best thing to do to help. Do you have any thoughts or comments on that?
I think it depends on what you are most comfortable with. And not only regarding you, but just in general. Some people may be in best position to give at during this time. Some people may be at suffering difficult hardships and not have that opportunity. Some people may be able to offer support and be able to volunteer and be able to help. But with people with small children or potentially elderly people in their household may risk exposing themselves or others. So it all depends on your level of comfort and where you believe that you can best contribute.
Great, thanks, Dwayne. Elizabeth, I think we should probably head on to our next speaker.
Yeah, we have one more question though from Rini. So Rini's asking, what is the longer term plan to address food insecurity? And what advocacy efforts would you recommend? Right.
So one of the things that you will see in the current HEROES Act that many people have been advocating for, specifically for SNAP, is for a 15% increase of the SNAP benefit. I mean, again, that's just one program. There's a lot of there's a lot of efforts that need to be made on multiple levels. It's not only addressing, one thing about the reason why I spoke about income is because it's, you think about food, you think about income, you think about childcare. There's all these different systems that really play a role within each other. And so there's a multi-level approach that needs to be taken that includes addressing food security directly, but also addressing some of these other systems that will also impact access to food.
Mm-hmm. Thanks, Dwayne. Okay, we have a couple more questions, so maybe we'll try to get these in, and then we're going to introduce our next speaker, Mary. So Crystal is asking, are there any resources for food delivery with statewide food distributions as a resource for residents with disabilities who don't have access to transportation?
I'm sorry, can you say that more? You started to cut out a little bit.
I can take that one, Elizabeth. The connection's a little wonky. Are there any resources for food delivery with statewide food distribution as a resource for residents with disabilities who maybe don't have access to transportation?
Yes, it's this group, I believe it's called Logisticare, who serve in a similar role with Medicaid, and it's also directly serving different participants such as that, and it's also free. So it's really geared towards people who are in need and have issues with access. The transportation has there's so much I didn't have a chance to address, but transportation has been a huge issue with being able to access food. So that's one that I recommend.
Great.
And it's logisticare.com, Crystal, but that'll also show up in the summary. So logisticare.com.
Great. Thanks, Casey. Thanks, Dwayne. Look, I'm going to ask you one more question, Dwayne. So Sean is asking if you have any information about food in the Atlantic City area. Right. So anything about food distribution, food access in AC?
Not anything that I can think of directly. I know there is a great network in Atlantic City. I would recommend checking out that link that you all sent for for Feeding America, because that'll give you exactly by the zip code all the information that you need for the food banks and food support staff that's there. And they do an amazing job at updating that as well, so it'll be very accurate.
Great. Okay. All right. Thank you so much, Dwayne. Hope you can stay on because we may have some more questions for you towards the end of our call. But now and I know everybody joins me in thanking you for being with us today. And now it's our great pleasure to introduce our colleague, Mary Celis. Mary is the Director of Health Initiatives at the Passaic County Food Policy Council at the United Way of Passaic County. And, you know, we became connected to Mary because of our friend and colleague, Inga Spungen from the Patterson Alliance. We worked really closely with Inga when we held our Creative Patterson Call to Collaboration back in 2018. And we're really grateful for our continued partnership with Inga and the Patterson Alliance. And so, Mary, thanks so much for being with us today. You can unmute yourself and I'm going to turn it over to you.
Thanks so much for having me today. Casey, do you have slides? Are they up?
I do. I'll go ahead and share my screen right now.
Okay, great. Thanks. I'm really excited to be here today. This is a topic that I'm really personally passionate about and something that we've been working on in Passaic County for a number of years. The Passaic County Food Policy Council is a cross-sector coalition that formed in 2011. Its vision has really been to end hunger in Passaic County by addressing the root causes of food insecurity. It brings together partners from across the food system and advocates for policies that make healthy food more affordable, accessible, and available to Passaic County residents. Since 2011, the Food Policy Council has really evolved. We know that there's been significant disparity across the county, and we've been trying to address that. And you know, we really, in 2016, we created a blueprint for action through support of New Jersey health initiatives, with the understanding that we couldn't really address the root cause of food insecurity without thinking about the other social determinants of health. And we created a plan to address issues around economic opportunity, community safety, access to clinical health care, and continued our work to advance strategies around healthy food access. The reason I wanted to show this slide is because, you know, we think about communities as ecosystems, and when we look at COVID-19 and how it's impacting low-income communities disproportionately, communities of color disproportionately, we have to continue to think about, you know, how communities really function and address all of these issues together. We can't think about hunger in a vacuum, and we really need to think about how it translates into other issues of inequity in the community. And housing isn't on here, education isn't on here, but we see them all as a part of a whole. And really, we've shifted our lens over the past probably 4 or 5 years to really address health disparities, knowing that we have residents that live in one zip code who may have a length of life that's 15 years less than communities that live 3 miles on the other side of the county. And so we have this lens of equity, particularly racial equity, that we've really embedded into our coalition. So you can go to the next slide. So kind of brings us into COVID-19. And so all of the work that we really do focuses on healthy food. We know that emergency food may be bigger than that scope, but we've really focused on, for obvious reasons, hopefully, healthy food access. And some of the challenges that our partners have been experiencing is obviously the increased demand for emergency food. We work really closely with the Community Food Bank of New Jersey, and they've increased their distribution to Passaic County by 68%. We're seeing partners in Southern Passaic County, in Patterson, Passaic, Clifton, other low-income communities really see, you know, in some organizations are distributing emergency food at the rate of 600 times or 600% greater than what they're seeing because of many of especially in Patterson, the surrounding areas, were low-income workers that we all can think about that didn't have any other options, and they've really been hit hard. Also, COVID has been impacting particularly the southern part of the county disproportionately because of high population density, because of train and other transportation access to New York City, which really was the epicenter of the epidemic or the pandemic. And so we've just really seen the need for emergency food and hunger really skyrocket. So it's also created supply chain shortages and food disruptions. You've all seen the articles about farmers having to let their crops fly fallow because of, their supply chains got disrupted to restaurants and to schools and all the other places that were purchasing food. It's also created workforce shortages. We've really seen interruption and inability to distribute food because of workers testing positive because of having to quarantine. And so there have been multiple barriers, people having to social distance and needing more physical space in order to work. And so that's been a significant challenge. Increased need for healthy food to improve immunity. This is something that I just can't echo enough. Food is incredibly, healthy food is incredibly important to build people's immune systems. And we've really been pushing this hard for the senior population, for the houseless population, for the medically vulnerable population. We've also seen increased costs due to additional expenses like PPE, cleaning supplies, packaging. We've had to reduce how we're utilizing volunteers because of concerns for their safety, and even people not feeling comfortable volunteering. And then on top of that, we've seen decreased donations to nonprofits due to the economic downturn and not being able to raise funds through things like galas and other fundraising events. And so that's been hitting the bottom line of a number of nonprofits. Go to the next slide. So with every challenge, there's opportunity, and there's particular opportunity to innovate. And I just want to say to whenever I speak about the coalition, I really am so proud of the partners. A coalition is only as strong as the partnership, and I hope what comes through in terms of the resource for other communities is just really to collaborate and the power of partnerships. And I'm really humbled and proud to work with so many talented, passionate partners that have literally been working around the clock to solve some of these challenges and problems. And so I can't say that enough. And so we've really continued to work and to think about how do we bring healthy food into communities, particularly where there isn't access, some of the wards in Patterson and other places. So we've continued to expand healthy corner stores and small business support to make sure that those businesses can stay open, that they have inventory for produce, and that they have support. And the Community Food Bank of New Jersey has been a strong leader in that area. We've also been really I'm really thrilled to be working with the Common Market, which is a mission-driven nonprofit food distributor based out of Philadelphia that's been working in New Jersey to increase local food procurement. We actually just secured 2,000 farm produce boxes that we're going to be distributing to seniors next week. And we're going to continue to expand that. The food system is broken. And now systems that were broken and that were challenged now have kind of come undone. And so we want to, again, continue to support policies and systems and environmental changes to think about long-term solutions and how we're going to leverage dollars to build more resilient communities. So investing in local food systems is really key. continuing to promote and expand community gardens and virtual wellness programs. I should have included farmers markets. We really work closely with City Green. They're a phenomenal partner, and promote the farmers markets that double the value of SNAP dollars. I think that that's going to really expand. Folks feel more safe going to farmers markets than a grocery store. They can be out in the community. We're actually and continuing to think about veggie mobiles that are mobile farmers markets that can come to senior centers. And then, through collaboration, really looking at how do we improve systems and build efficiencies with limited resources. And so there's a group that's emerged, and they're calling themselves the Passaic County Pandemic Partnership. And I just want to give them a shout out. It's organizations that include CUMAC, Patterson Habitat for Humanity, Passaic County CASA, Oasis, Star of Hope Ministries, and the Boys and Girls Club of Patterson and Passaic. And the reason I think that we really try to model, in times where we're facing resource scarcity, how do we collaborate and leverage volunteer teams? How do we share information so that we're addressing vulnerable populations? And so they've been able to identify families that are needing to quarantine, who are food insecure, and actually make deliveries using volunteers to reach those families. And so, again, the power of partnerships and building efficiencies is really key during this time. The City of Patterson is also innovating and launched a Neighbor Express platform to deliver groceries to seniors. And so we're really excited to partner with them by, helping supply volunteers, and to think about how can we leverage some of these community support models to be able to reach folks who are particularly vulnerable. And, again, I'm just going to harp on this moment or this idea for a minute around collective impact. When we're able to identify a common agenda and a shared vision, and then, really create efficiencies and coordinate activities, we can have so much greater impact than we would as if we were functioning as individual organizations. And so, I think that if I were to leave on any note, it would be just to, again, lift up the power of partnerships and working together collaboratively across sectors, across the public-private sector, because we all need each other. And there have been so many instances of, for example, when the school district, their driver teams had to quarantine. There was nonprofit partners that said, well, we're going to donate our trucks and our drivers to be able to make sure that those food distribution sites at schools can continue to function. And Patterson Public Schools is leading the way across the state in terms of feeding number of students. And I think that it's been because, in part, they've done a phenomenal job, but there's been just the power of a coalition that's communicating where those sites are, that's helping problem solve when they run into logistical issues. And so that's kind of some of the things that I want to share with you today, and I can open up time for questions.
Thank you, Mary. Thanks so much for all of that information. And we've got lots of additional information that went into the chat function. So Mary, if you don't mind, I want to ask if we pause on your Q&A right now and we go to Alex, our third speaker, because we know that Alex has some time constraints this morning. She's actually got another call at 11 o'clock. So we're going to ask everyone to just hold your questions right now for Mary. We want to introduce Alex Wills from Cathedral Kitchen in the city of Camden. Alex is the Community Relations Director. We were able to work with Alex and her colleagues at Cathedral Kitchen when we were doing our community building work in the city of Camden, when we held our call to collaboration down there. I think it was 2017. So we're grateful for our continued partnership. And Alex, Thanks so much for being with us today. I'll turn it over to you.
My pleasure. And thank you so much, Casey and Elizabeth, for inviting me today. And I'm happy to be here with Dwayne and Mary and all of you to talk about some of the needs and how we're all basically making adjustments in light of COVID. So I wanted to start briefly with just a little overview of Cathedral Kitchen for those of you that aren't familiar with our services, and then tell you how we've changed, and then a little bit more about what's going on in Camden in terms of what's available and in terms of food security and insecurity. But an overview of Cathedral Kitchen. So we're Camden's largest soup kitchen and food provider. We serve an average of about 300 guests each day, and our numbers have roughly stayed the same. March and April, we were a little high, and now we're a little bit lower. So, you know, we're just kind of riding the wave to see how that's going, but give or take, it's an average of 300 guests each day. We are continuing to serve dinner during the week, Monday to Friday, and that's from 3:15 to 5. Lunch on Saturday, 12 to 1. We're closed on Sunday. Pre-COVID, we have a dental clinic. We also have had nurses come in. We have a culinary and baking program, and we also have a lot of catering. We have a cafe, we have a food truck, we have a garden, and we also have a contract catering job where we prepare 1,600 meals each day for 8 local halfway houses in shelters in Camden. So that's a little overview of all of our programs and services. Now that's all pre-COVID. Now with COVID going on, we are continuing to maintain our main mission of serving our guests each day. Obviously, we've been changing it over the last 6 to 7 to 8 weeks now. So most recently, our guests can't come into the dining room. So what we're doing is we're serving our guests a hot to-go meal at the door, with also a takeaway bag of food and a bottle of water. Fortunately, the county has set up 2 porta potties and 2 wash stations out front. So since our guests can't come into the kitchen and in dining room and use the lavatory, we're grateful to have that availability. And like I said, our guests get a hot meal each day, so we're really glad we can continue to support that. We are also doing the social distancing, which is actually working out fairly well. We put markings on the pavement out front. If any of you have visited the kitchen, basically the lines go all the way down to the traffic light to the left-hand side of our building. And it's been working out pretty well. We've been getting a lot of support from law enforcement in encouraging that, and the guests have been pretty good. We've also given our guests some literature pre-COVID, just about, washing your hands and things like that. Then with COVID, we've also given them literature in their bags about, the symptoms of COVID, what to recognize, the importance of social distancing and things like that. So that's some of the changes that we've been making. Obviously, we've suspended our volunteers, and that's been for, just about 2 months now. And we're really volunteer driven, so our staff is working obviously full force. Our dental clinic has been suspended until hopefully June, and our nurses are coming back in June. With our catering, that's been suspended, but we are continuing to do our 1,600 meals each day for eight local halfway houses and shelters, and that's 7 days a week. So we are still doing that contract job, and our culinary and baking program has been suspended, but we hope to reinstate that pretty soon. In terms of ways people can help with us as well as other agencies in town, I noticed a question earlier about the Ronald McDonald House. Obviously, for nonprofits, that's, financial support is paramount. That way, we and everybody else can buy the supplies that we need. So that would be all of our #1 requests for buying, the food and other donations that we need. When we have our takeaway meal for our guests, we put sandwiches in there. We put healthy snacks, so it might be like protein bars, trail mix, granola bars, like I said, the bottle of water. We put fruit in there. So we have had an outpouring, a flood of support from our volunteers, from local churches, mosques, everything, you name it. It's been wonderful. It's been to the point where we've been giving our guests 5 meat and cheese sandwiches each day. And that's the takeaway meal in addition to the hot meal. So we, excuse me, we are blessed with a lot of support. Excuse me, allergy time. I don't know about you, but I'm suffering. Sorry about that. So it's actually been to the point where now we've had to kind of pull back a little bit, because even with a lot of the outreach we do, because we're the largest food provider in Camden, with the zero contact, a lot of the people that we provide food to have not been able to accept deliveries or have not been able to pick up food from us. That's been opening up a little bit. So usually we give food to 3 senior centers in Camden, and now we are doing 1, and we're hoping to do the other 2 soon. Urban Promise has a lot of youth programs in town. We are able to give food to them. Lucy Outreach, a few of those in town. So we are able to deliver again. Some of them are able to pick up. So, you know, our flow is starting to increase. So we really appreciate that. Produce is coming in, and it's great. We're able to get that out. Another need, you know, it's a tangent on food, but toiletries. You know, that's a big need for us, and we are giving our guests toiletries a couple times a week now. So, and we also are doing that with the outreach. So it's really important, as you can imagine. And socks, you know, always socks. Never have enough socks. The other thing, that's what's happening with Cathedral Kitchen. All of our staff are wearing masks, and now we're starting to give enough masks in where we're able to give them to the guests as well. So, so our food, you know, the donations have been down from, you know, restaurants that have either closed or curtailed their activities. So in terms of, you know, the supplies that we're getting in, we are purchasing a lot more food. And of course, our income is down with no catering and with our cafe closed. But like I said, the outpouring of support in terms of, you know, in-kind donations and, you know, financial support, you know, has been wonderful. And we really appreciate all the support. I did send Casey a couple of links that she's going to put in the summary tomorrow. So there are a lot of programs in Camden that are doing a lot of wonderful things. Cooper's Ferry is working with the South Jersey Food Bank, and we're working with Farmers Against Hunger. You know, they're providing, you know, the other day it was 10,000 pounds of produce and milk to hundreds and hundreds of families in Camden. So there's a lot of that going on. When you see the list from South Jersey Food Bank, it's quite extensive. So there are a lot of pantries that, you know, where folks can get food, and a lot of pantries are starting to open up if they kind of had to close for a little while. Also, there are a lot of spots that are set up for the families and children to get the meals while they're not in schools. We haven't really been getting a lot of families for a while now, you know, mostly due to the fact that they are able to get a lot of food and groceries at a lot of these different locations. So we're still typically mostly seeing 3/4 of our population as men, with about another quarter women, you know, very, very limited families. So families do have a lot of access to food. You know, there's places, Meals on Wheels is still delivering down here. You know, like I said, the food bank, there's a Touch New Jersey food pantry, Catholic Charities, a lot of places. And then you'll see in the other summary that Casey's going to send out is from Camden Coalition. There is a section about food, but there's a lot of other resources available in there. It's a really great tool that, you know, please share, send it out, you know, use it for whatever needs that you find. So there's a lot of, you know, support. There's a lot of consistency with the meal service, but obviously a lot of adjustments have been made with how the process flows. So that's kind of an overview of what's happening here, if anybody has any questions.
Great. Thanks, Alex. Thanks so much for sharing all of that great information. So we'll open it up for a Q&A for both Mary and Alex. I'll turn it over to Casey. Mary, if you want to also unmute. And also, you know, Dwayne, we might have a couple of questions for you as well. But thanks again, Alex and Mary. And so, Casey, I'll turn it over to you for some Q&A here.
Great, thanks. So as a reminder, folks, you can drop your questions into the chat function if you're joining us on video. You can also raise your hand by going to the participants function if you're on video. And if you're on the phone with us, you can *6 to unmute yourself. You hit the star button and the 6 button. So while people are getting their questions together and letting me know what some of those are, there was a previous question that was related to the question about access for folks who have functional need or disabilities. And it was about, are there any resources for folks who are not part of the Medicaid program that might be available, again, to folks that have, you know, different abilities. So I don't know if that's a question that either of you guys could answer, but I wanted to make sure that we got to that one.
Well, with any of our food, I mean, it's available. Of course, no ID, no paperwork, no questions asked. The only thing is we don't deliver food like Meals on Wheels. So anybody that had any needs, they would have to come to our site in order to get it for individuals. There are some agencies where we deliver, you know, like I said, senior centers and things like that, but we don't do, you know, individual deliveries, you know, at least at this time.
Great, thanks, Alex. I'll open this up to folks on the phones, just because I know sometimes it's hard to get in on that. So if anyone from our phones has a question, go ahead and hit *6 to unmute. And then again, feel free to drop any questions into our chat button or to the raise your hand function.
Mary, I have a
And I'm
question.
just going to scroll back through.
Sorry, Casey. Mary, I'm wondering you gave us so much, a lot of great information about how the Food Council in Passaic is working and the partnerships that you've created that really allow you to have the impact that you're experiencing. And so I wonder you know, we've got folks from all around the state who are on the call with us today. Is there a place where they can go, and forgive me if this was actually put in the chat function and I missed it, but I wonder if, you know, is there a way, should folks look at the United Way in their counties? Is there a way for them to find out more information on what's happening in their county? You know, if they're not based in Passaic, like how would they access that info? Do you know?
Sure, and that's a great question. You know, the way that the United Ways work is we really respond to community needs. And so every United Way really functions differently. I don't know of any other United Ways that have a food policy council. I know that there's a food policy council operating out of the YMCA in Elizabeth, I believe, and there may be other coalitions across the state that are connecting or collaborating, but I certainly think that there's a need. I'm happy to have conversations with folks. I've been doing it in neighboring counties around, you know, what does it look like to get started or to even collaboratively respond to some of these challenges that we're facing in food distribution. So I'm happy to set up calls with folks if you know, you can provide my email. There are coalitions obviously across the state. I'm a part of a cohort through NJHI, but food is not necessarily you know, a part of like all of the work that's happening across the state. But I'm happy to make connections as I can. The other thing I just wanted to mention as a resource is to really reach out to your local food bank, because they were funded to provide COVID specific emergency food. So, and they've changed the way that they're operating in terms of making deliveries. They're doing more prepared meals, particularly for seniors, emergency food boxes. And the USDA just, if you didn't see it in the news, just funded, I think it was about $3 billion across the country to purchase from local farmers and distribute it through distributors. And the Common Market is just one of those distributors. It's also Seashore, Zone 7. So in the state of New Jersey, there should be access to these farm produce boxes for distribution. And they don't have requirements around who they get delivered to. Is really nice.
Great. Thank you for that information.
Great. As of right now, I'm not seeing any other questions being dropped into any of our boxes. You know, as folks know, we're going to stay on after our official ending time at 11 o'clock. But and I eat my words right now. We've got another question, Suzanne. If you want to go ahead and unmute yourself.
Hi, everybody. I just wanted to jump onto that last question and respond that at Together North Jersey, and I'm going to put it in the chat box, the actual link. We have done a food access project through the livable task force with Together North Jersey, and that has some great resources, a big list within that, and I'll post that for you, Casey. You don't have to look that up. Actually, I'll post it right now. There it is. And also, we're going to be continuing this conversation within the Livable Task Force at Together North Jersey. We're looking at affordable housing and transportation access right at the moment, but there has been a call most recently in our meeting last week to look more, again, further into the food access and equity framework. So I would invite any of you in the 13 Northern New Jersey counties who wish to participate with us in the Livable Task Force. You can contact me. I'm the co-chair, or you can contact togethernorthjersey.com directly. Okay, thank you.
Thanks, Suzanne.
Thanks, Suzanne. I do see one quick question for Alex, maybe right before you jump off, Alex. One is, are you still distributing hygiene products?
Yes, we are. Thank you. We are getting a lot in. We really appreciate it. What we're asking for now are sample sizes, only because the guests are carrying so much, it's a little bit easier for them. And we are requesting about 6 products in particular, because our wish list has about 30, but we're looking for sample size of like hand lotion, body lotion, hand sanitizers, toothpaste, and then obviously a full-size toothbrush, full-size deodorant, and then in men's socks, you know, that I'm putting that under hygiene products, but they're pretty much the ones, the soap and sample size soap. They're the ones that we're highlighting right now, and we're able to give our guests hygiene products like a couple times a week now, which is really great. So if you want to do a drive or something, that's what we're looking for right now. So thank you for the question.
Great. Thanks, Alex.
So I'm not seeing any other questions at the moment.
Yeah, sorry, Casey. Yeah, so it's just 2 minutes after 11. So does anyone else, before we officially sort of thank our speakers again and end the recording, does anyone have any other question for Dwayne or Mary or Alex, or a comment?
We do have, oh, no, apologies. There's not another comment there. I'm basically just saying, thank you, this is so helpful, which we've seen throughout all of the chats over the course of this entire call.
So, you know, I know everybody on the call, you know, joins us in thanking the 3 of you, Dwayne Currie, Robert Wood Johnson Foundation, Mary Celis, Passaic County Food Council at the United Way, Alex Wills, Camden City's Cathedral Kitchen. We learned a lot from you today. I hope that everybody, for all of the great information that we learned, that we pass this information on. As you know, we're going to send out a summary report with all of the links that were put into the chat function. You'll have that sometime tomorrow afternoon. Casey just put into the chat function again about the census. If you haven't filled out your census, don't forget to do it. Don't forget to ask all of your, you know, friends and extended family members and people, your colleagues, people in your world, encourage them to fill it out. We want to make sure that New Jersey is counted properly and as accurately as possible. You know, we know everybody is still feeling a lot of pressure with the shutdown. So if there's anything that you think any of us at Creative New Jersey can do to help advance dialogue around the critical issues, keep people connected, help to build networks, that's what our mission is. It's what we're here for. We're so grateful to everybody who's, you know, participated every week, our speakers and all of you in these calls. Just a reminder, next week, there's no call next week. We're just going to take a breath. It's Memorial Day. We wish you all a very safe and happy holiday. And then we're going to come back again for 2 more calls on Wednesday, June 3rd and Wednesday, June 10th. So stay tuned for some more information about that. Casey, anything else that you'd like to add before we officially end our recording? No?
No, I think we're good.
So thank you all for being with us today. We're going to stay on for a little bit afterwards so folks can continue to connect, but We're really grateful to see everybody today, and stay strong and stay healthy. Thank you all.
You too. Thank you.